So last year we published a paper in Nature Medicine with the group at Memorial Sloan Kettering, Dr. Marcel van den Brink. And that was really the first study to show that the gut microbiota can have an impact on the function of CAR T cells. And so the study focused on a retrospective cohort of patients, about 200, and is a sort of marker of the quality of the gut microbiota. We use the exposure to antibiotics. So antibiotics, of course, are given to treat infections, but they also have the ability to inhibit the proliferation of bacteria in our gut. And so they definitely damage the diversity of the gut microbiota. And so we analyzed about 200 patients and we look at the use of antibiotics before CAR T cells. And what we found is that patients that were exposed to antibiotics in the 4 weeks before CAR T cells infusion, they had a poorer outcome. So they had a lower progression-free survival and a shorter overall survival, indicating that perhaps the use of antibiotics can be detrimental to CAR function. We also ran multivariate analysis to make sure that there were no other confounding factors, of course, and still exposure to certain antibiotics in particular was associated with poorer outcome. And the second part of the study was to look at the actual microbiome, so the composition of the gut microbiota. And we did that again with Dr. van den Brink, and we sequenced the stool of about 50 patients. And there was some interesting correlation between the type of bacteria in the gut and the response rates, or the type of bacteria in the gut and the toxicity. So definitely there is a role. Of course, we need to do more studies to understand what's the real impact and how to modulate the gut microbiota.